you guys so much. It was a great opportunity for me to be here with you guys all. Yeah, as stated above, I work at UCSD and at Rady Children's Hospital doing sports medicine for kids. And I've also done a lot of teaching regarding the perils and pitfalls of controlled substances. So we're going to talk about that today, and especially talking about focus on the children. So obviously the issue of controlled substances, including opioids, is a big deal that affects multiple of us in so many different ways. It has risks, and an obvious important risk is opioid addiction, abuse, and overdose. In fact, last year, because of social isolation and job loss, we had the highest incidence of opioid overdose in the history recorded by the CDC, where they published data of about 120,000 Americans perished because of this condition. So we're going to talk a little bit about where this came from and what we can do about it. So we've had the problem of opioids around for about 150 years. In fact, we have had revolution in Southeast Asia, the Boxers' Revolution, that was about opium trade. And then back in 1960s and 70s, we sent our best and brightest young men to Vietnam to fight the war. And many of them, unfortunately, came back addicted. Now, this was all not just opium-based stuff. It was actually medication. So one of the doctors that I've worked with, when he was a soldier out there and got injured, went to his corpsmen, he was given 500 tablets of an opioid that he shared with everybody in the barracks. When many of these soldiers came back, about 20% of them were abusing opium-based products in Vietnam. When they came back, fortunately, to their friends and their family and their communities and their jobs, most of them were able to kick the habit of opioid abuse, which is great. However, 5% still remained using these drugs. These are 17, 18, 19-year-old, 20-year-old young men who were abusing sometimes heroin at the time. This became a public health big emergency, and there was a war on drugs built around this, as well as a lot of new laws were developed. The the Drug Abuse Enforcement Agency was started, and schedules were made, and the Controlled Substance Act was created to kind of regulate all these medications. The first schedule was obviously potentially the most important, and that is Schedule I drugs that we cannot prescribe except in research settings. And this, of course, included heroin. Now, heroin was developed in 1870 as an antidote to get people off of opium. And that obviously didn't work since patients abused heroin. That was placed right away on the list. Marijuana is on the list. And there is a prescription version of marijuana called Marinol that has just THC in it that doctors can prescribe, but marijuana is on the list, and we'll talk about that, as well as some other of these drugs. Now, if you look at the map here shows all states in the United States have different laws regarding marijuana use. Some have decriminalized them, some have special taxes on them, and it's very confusing, actually, to people. In fact, with marijuana alone, we have in Colorado and in Denver, more marijuana dispensaries than McDonald's and Starbucks combined. So one of the offshoots of this liberalized use of marijuana, which is a Schedule I drug that doctors cannot prescribe, one of the offshoots is potentially is a gateway drug for our kids. Since more and more kids are using marijuana in states that have made this a decriminalized or make it without prescription, like in California or state of Washington for adults, we've now seen doubling use of our kids. And marijuana is on the lower side for harm of all the drugs that you can use, if you have to think about it. But one of the big concerns we have, and we'll talk about it with one of the newest versions of the laws and one death at the end of our presentation, is could this be a gateway drug to other drugs? In fact, alcohol is probably more harmful than marijuana. Smoking may be potentially more harmful than marijuana, although marijuana vapors now have been shown to be extremely harmful when mixed with like vitamin E oil, destroying the lungs of some patients, children and adults around the country, leading to sudden deaths, actually. We're going to talk about some of these other drugs: benzodiazepines, ketamine, barbiturates, methadone, cocaine, and heroin, of course, as well. The DEA's mission, which was born out of this enforcement situation and war on drugs, was to prevent, detect, and investigate a diversion of controlled pharmaceuticals from legitimate sources. They also want to make sure that we get these medications for legitimate reasons. Now, with this war on drugs, we've been monitoring children around the country, and this is the monitoring future study, and we have data every year that we've collected. And if you notice, I brought this data set that shows about in the mid-90s, we turned a corner. And with our children, we've reduced the amount of alcohol abuse, reduced the amount of cigarette abuse, reduced the amount of some street drugs, and we were thinking we were winning this war on drugs. This is actually not the case. It turns out that the war on drugs is much more complicated than we ever thought. So this is the data from the Office of National Drug Control Policy. It's a branch of the White House. It's data from SAMHSA, which is called Substance Abuse and Mental Health Services Administration. It's part of Health and Human Services, and data from the NIDA, which is a big branch of the National Institute of Drug Abuse, a branch of the NIH. And what they published data that is about, it's really interesting, about 50 million Americans, about 20% of the US population, have misused or currently misusing prescription controlled medications. The most common is opioids, of course, but we can't forget sedatives like benzodiazepines, like Xanax, which is extremely addicting, or stimulants like Adderall, which are sold in college campuses, and probably at least 10% of students are buying and selling these drugs to help them take tests and stuff. Now, where do kids get these drugs? So one of the pictures I have on this map is a child that's going to the medicine cabinet. And so if you go into medicine cabinets of grandparents today, you'll often find old bottles of opioids or benzos that are just hanging out there. For anybody, really, there's no lock and anybody could get this. Now, where do our kids get these drugs? Just like adults, kids can get it from doctors. And in fact, maybe 20, 30% is from doctors, but also kids get it from friends and relatives and drug dealers and other people who are selling these things. And it's interesting when you think about it, some kids will go to parties and they'll have like a trail mix party where kids will come in and they'll get some drugs from their grandma's closet and they'll throw a pill in there and they'll pick a pill out that they don't know what it is and they'll just eat it or drink it. And so this is a national crisis, and it's been a problem for a few decades now since we have liberalized the prescribing of these controlled medications. As you can see, drug overdoses are a big deal from a public health standpoint. Car accidents certainly are a big deal. Guns are certainly a big deal in terms of gun violence. HIV used to be as big a deal before we had AZT and other treatments, and now has made it less. But drug overdoses, and the majority of which are prescription drug overdoses, are far and away the biggest public health problem from a standpoint of deaths. And this is not just the US. So this is data from Canada that shows that children between the age of 15 and young adults and 24, 1 in 9 deaths were opioid related. And then middle-aged adults, 25 to 34, young and middle-aged adults, 1 in 6 deaths were this way. Here, data from Yale, published recently, shows that the pediatric mortality rate from prescription overdoses has risen a lot in the last decade, probably about 300%. So we're seeing a big rise in this all around the country. Now, is this intentional or unintentional? We think most of this death is unintentional. Like children who get some of these drugs, they can't tell if a Vicodin tablet they got is laced with fentanyl or not. It's impossible. And so it's easy to overdose if you're using these high potency opioids. And it can be easy to overdose if you add alcohol or a benzo or something else in there. There is some suicides, it's not zero, but I think majority of this is unintentional. Now, California lawmakers know this, so they passed some special laws to try to reduce this problem. In the law, it's called Assembly Bill 2760, which just recently passed in 2018, it says abuse and misuse of opioids is a serious problem that affects health, social, and economic welfare of the state. And the law states that prescription drug abuse is the most commonly abused substance by Americans over 12 years of age. And millions of Americans are abusing these drugs. And they say in the law that this is the reason why we've seen for the first time before COVID, the reason why we see life expectancy in the United States dropping. It's because of the prescription drug abuse reasons. And the reason why this is so big is it turns out when someone dies of cancer or heart disease, they often die in their later decades of life, 70 or 80. And it has very little effect, 60, 70, 80, on the overall survival population. But when you have a kid, 15 or 25 dying of prescription overdose, it dramatically affects the survival curves because they're so young. So that's why we see this drop. Now, opioid overdose and opioid abuse and illegal drug use, prescription or non-prescription, is rampant. As you can see from this graph that was published in 2011, more of the drug abuse amongst all the groups is actually prescription than illegal street drugs. But it's a problem of all ages, including our youngest kids all the way to our seniors. And although the numbers, relatively seniors, look small, this is 250,000 seniors over 65 addicted to prescription drugs. So it's this number here is like 7 million or something. So this is a big number. Now, many deaths that are labeled cardiac arrest actually turn out to be drug overdoses. Why is that? Well, doctors are the ones who write the death certificates, and they will put down something other than themselves when it's when it's related to prescription drugs. So in this study, what they found in UCSF when they went and did autopsy down on these patients supposedly who died of cardiac death, what they found is in fact 22% had no heart problem at all. They actually died of overdose of opioids, benzos, and stimulants, many times taking combination and sometimes taking just prescription drugs that they're prescribed. About a half of this prescribed, about half is diversion. Diversion means somebody gets a medicine, then somebody else takes it, whether it's intentional or unintentional, the other person takes it, that's called diversion. And we talked about this before. This is for high school students. And if you look at it, about a third of the prescription drug abuse amongst our high school students is from doctors themselves, prescription medicines from doctors. And recent data from children found that if a child gets an opioid for an ACL surgery or a dental procedure, 17% admit to misusing those drugs. Now, that's not the only group. In fact, friends is a common place. Selling, so there's dealers involved with all of this. So this is a big deal problem even in college. Now, how did this get to be such a big deal problem? Well, one of the reasons was marketing. So if you see the marketing that happened when we created the fifth vital sign for pain, it turned out that a lot of marketing happened. Sales went up for prescription painkillers. This is from 2000 to 2010. Treatment went up and proportionally deaths went up. So the more we treat people with opioids and stimulants and benzos, the more people who die from it. It's just a linear relationship, actually. And you can see the amount more that we increased during this time between like 2005 and 2015, or 2000 and 2015, we actually tripled or quadrupled the amount of opioids we're giving to Americans, which is a tremendously big number. Now, here's a picture of heroin abuse and how we're going to talk about heroin, because it's a big cause of death. And clearly, this is a big problem we should kind of address. And I've had one of my patients actually was a Torrey Pines High School student who started with marijuana abuse and became eventually addicted to heroin, living under the freeway overpass with the 56 and the 5, and working at Ralph's. During the time that he was living there. And the reason he was living there, his mom kicked him out because of the heroin abuse. So heroin abuse is obviously a big deal and become more recently. And where does this start? Well, it turns out that 4 out of 5 people who abuse heroin started first misusing prescription painkillers. So if they're abusing opioids, they're 40 times more likely to use heroin. So this is, when we think about prescribing opioids, we should be thinking very carefully about this to make sure doctors don't, and physical assistants, physician assistants, and nurse practitioners don't inadvertently start a crisis. And so it should be a momentous occasion if we prescribe it to anybody. So let's talk about the 3 waves. So there was 3 waves. So the first wave is all this marketing by Purdue Pharma and Indo Pharmaceuticals selling OxyContin to doctors around the country, etc. So we started prescribing more in the early 2000s. Then doctors got the message, oh my gosh, we have to stop this. When doctors stop this, immediately we see an uptick of heroin. Like we talked about, where does heroin abuse start from? Patients don't just decide, I'm going to inject myself with heroin. This is not something people like to do, is poke themselves with a needle. If they could get the same drug, same opium-based drug from a doctor, they'd rather do it. But when we see the doctors flattening out and stopping, we see this rise in heroin. And more recently, we see this rise in fentanyl. So where did that come from? All the fentanyl is made in China, and it's made, and we use it for medical purposes, but it's also being laced in other drugs or even prescription drugs and sold on the street. So a Vicodin, which is hydrocodone, low potency, is mixed with fentanyl, and kids, adults, they can't tell the difference. And so we're seeing this big uprise in fentanyl deaths. So with three waves, you have the wave of prescription doctors doing it too much, then heroin when doctors started reducing it, and now synthetic opioids, fentanyl. Now, if you get prescribed an opioid, what's the chance that if you get prescribed for a good reason, like an ACL surgery or a dental procedure, what's the chance that you're going to die secondary to this decision? It actually doesn't happen right away. It's actually 1 in 550. And the number seems high. It's way higher. The ACL surgery, no one dies from ACL surgery. But the drugs that we use for a post-op, after surgery, we discharge a patient, have this tendency to lead to addiction in a very small number, but that doesn't have to be too many to kill patients. So 1 in 550 will die, and the average death age is about 2.5 years later. So it's tremendous burden on society when a young person dies, overwhelming for family members if a young person dies from this. And in a way, it's needless because we can actually do these procedures and send the kids and adults out without opioids to begin with. In fact, in Europe, they already do that, where only 9% of patients after surgery leave a hospital with an opioid, while 91% of the United States do. So what about if you get a high dose? If doctors decide you need this massive doses to over 200 morphine equivalents, which is a very high dose, that kills a lot more people. So 1 in 32 die. So this is obviously very dangerous. This is a picture from the LA Times. This has changed. This is why we have the second wave. How did this happen? So it turns out this is a mother protesting in front of the State Senate of California for her child. There's a picture of her child who died of an overdose. Her child was given opioids by a doctor, and there were 7 mothers protesting about the doctors that overprescribed to their children. They were older teenagers or young adults, I'm not exactly sure. And they were protesting and saying, we've got to stop these doctors. The Senate of California didn't know really what to do, so they asked the medical board to figure this out. Medical board said, we don't have resources to really police all the doctors, but then they created a law, said you have to do it. So now they're policing the doctors. Doctors are stopping prescribing dramatically, and we're seeing this second wave. And these kids actually all died of doctor prescriptions. Now, how much doctor prescribing was there going on? Well, we started monitoring the Schedule II drugs, the most dangerous ones that we prescribed in 1939. That was called the California Triplicate Prescription Program, where doctors would write on a carbon copy, and 1 copy would stay with them, 2 copies would go to the pharmacy, 1 copy pharmacy keeper, 1 copy was sent to the state. This is just Schedule II. And in 1999, we expanded it to cover more drugs, Schedule 2 through 4. And these are still a fraction of the types of drugs that doctors prescribe, just the controlled drugs like benzodiazepines and opioids and stimulants, that kind of stuff. And what they found is, in 2011, they published the data that 2.7 billion doses were given by California doctors. That's 100 doses per adult in California. That's McDonald's numbers. In the old days, I would be driving by McDonald's and you'd see the McDonald's sign would say, how many billion served? That's like McDonald's numbers. It's crazy that this would even happen. Of course, this is dramatically dropped now. This is a question which you guys can't answer, but one of the interesting things, it turns out that a lot of people die every day from this all around the country. Opioid prescribing varies state by state, county by county, a lot. Even in San Diego, if you're east of the 5, we have 10 times opioid prescribing as west of the 5. Real story. Healthcare providers write a lot, and state laws have a big effect. So let's talk about the state laws. Let's also talk about the triplicate program. So California had this program that made it a little harder for doctors in California, and it really helped reduce opioid prescribing. And does it help reduce heroin deaths. You'd think doctors not prescribing heroin. Did it help? Well, here is data from the Uncertain Hour. It's a really wonderful piece of journalism that's done on and a podcast, and you can get this podcast. And it shows you this interesting data that in states that didn't have triplicates, we had a high amount of OxyContin prescribing. In the triplicate states like California, where doctors had to really be careful and write this on a carbon copy and everybody was keeping track, they didn't want to prescribe it as much. And so what happens? Well, heroin overdoses 10 years later were 2.5 times less in the states like California, New York, Texas that had these laws to keep track of the OxyContin prescribing than in other states where you could just prescribe it like a regular prescription without carbon copy and all this stuff. Now, why is that? Why would that be? It turns out that doctors, first of all, are less inclined to prescribe in the states where we have these triplicate forms because they're worried about being monitored. And the company, Purdue Pharma, was less inclined to market there because they're not going to sell as much of this drug. And Purdue Pharma even did a focus group that was uncovered in a lawsuit that said these doctors were scared because they were thinking the government was monitoring them. So California citizens are less likely to die of heroin abuse than states where they never had this, and partly because they never were hooked on OxyContin to begin with. State laws have a big effect. So Florida used to be a red state. Now it's kind of purplish, right? And how did that happen? Well, in terms of the opioid crisis, how did it happen? It turns out that laws were enacted to limit the prescribing of all these crazy amounts of opioids. And when they did this, they dropped oxycodone prescribing by 1/4, which was amazing. They dropped oxycodone prescribing by 1/4, but subsequently they dropped oxycodone deaths by 50%. So how is that? How is it double? If you just decrease oxycodone by 24%, you're decreasing deaths by 52%. Well, the reason is just a little bit of pressure on prescribing has a long effect, a big effect on patients. So overdoses go down as doctors prescribe less of this stuff. Less of this stuff is in the community. Who is vulnerable? It's not the general groups. So general groups in COVID are African Americans, Hispanic Americans, people who had to work during COVID, people who are obese, all this stuff. Turns out with opioids, it's kind of the opposite. It's the Heath Ledgers of the world who were basically filming the Joker and doing work and had to get off of his benzodiazepines, his Xanax, and get off, or Ativan or whatever, and get off his hydrocodone so he could actually film the movie. And then he goes home to New York, wants to rest 2 weeks before his next big film shoot. And his girlfriend feels sorry for him, thinking that he's so tired looking, and gives him a little bit of her Xanax, takes his old medication, plus the Xanax. She goes to get pizza. She comes back, he's died from this overdose. And so it turns out the people that we love the most, our school principals, our superintendents, our police chiefs, our friends, doctors' friends, our colleagues, etc. We're the highest risk. Our patients that seem to be famous are the people who get the most of these drugs. Michael Jackson is a perfect example of this. And an interesting problem, this seems to affect younger people more than older people, because we're a little bit more cautious with older people. It affects whites and American Indians and Native Americans high, and less common African Americans, and very low rates in Asian population, which is very interesting. The least mortality of drug overdoses there. So are doctors more at risk of this? Do doctors die of this problem more than just their patients? Well, it's interesting data. Here's a doctor from UCSD who was caught using a bunch of opioids during this is not his picture, but it's another picture of another doctor, or a fabricated doctor, using these drugs for himself, was sanctioned, was put on probation, went through his probation, was given back the chance to go through his residency in anesthesiology, became in faculty at UCSD, and then had to surrender his license. Why? Because while patients were getting surgery at UCSD, he was using some of the fentanyl for them on himself, was actually found down in the bathroom, overdosed multiple times, and eventually had to give up his license. And now he's telling everybody about the hundreds of patients that he took these drugs from. So you think, how is this possible that doctors who should understand this are doing this? Well, it turns out that drug abuse is common amongst everybody. about 10 to 15% of the population admits to some drug or alcohol abuse. It's common, but for doctors, drug use is more common than the alcohol version. So 69% of doctors who have an addiction problem is addiction to prescription drugs. In fact, I have met a doctor who runs a propofol, which is a drug that Michael Jackson died from, support group of other anesthesiologists in Orange County. There's like 30 of them who formerly use this. So anesthesia, emergency room workers, not just the doctors, because they have access, and psychiatrists are more likely to have this problem. Now, states. Certain states prescribe a lot more than other states. So in Alabama, we prescribe 3 times as much as Hawaii. Now, why is that? Why could that be? There doesn't really make a lot of sense. Interesting enough, we talked about Asian Americans have the lowest opioid overdose rate, and there's more Asian Americans maybe in Hawaii, but even California is relatively lower because maybe the triplicate rules or whatever. So this is the area, the mid-Atlantic area, Appalachian area is probably the highest use. And if you look at county to county, this is why Walmart is in trouble. So Walmart knew about this. Officials at Walmart at the very highest level had emailed each other about sending 50 times as much opioid products to some counties as other counties. And they kind of joked about it, which puts them, now these emails are out there, puts Walmart in jeopardy with these major lawsuits happening around the country about this prescription drug use. It turns out opioids and benzos combined, again, a problem in those same states, another big issue that we should worry about. Now, these are probably the most important big drugs that doctors prescribe that have the most dangers. If you see on this list, you see Ritalin, and actually all the stimulants are on this list. Fentanyl, oh my gosh, is on this list. Morphine and methadone, barbiturates, hydrocodone now is on this list. All this stuff's on this list. Cocaine's topical cocaine, which is rarely used, on this list. So why do drugs get on this most restricted list that you cannot write a refill? Well, one of the interesting parts about this is it's something to do with risk. It's not just diversion. It's not just abuse. It's also the risk, and not just overdose risk, but the risk itself of the drugs. These are useful drugs, but they also have risks. And let me tell you a story. So one case I was involved with was about a young boy who's 9 years old, and mom had taken him to his ear, nose, and throat doctor for multiple strep infections. This doctor did a tonsillectomy and adenoidectomy, and the child was sent home on Tylenol, but didn't like it. Mom didn't really like it too much, so she didn't really want to force her son to take opioids anyway. But his son stopped eating. She didn't worry about that as long as he was drinking, taking his Jello, etc. Then he stopped drinking and taking his Jello, and she started getting dehydrated. So she calls the ENT doctor and says, what am I going to do? My son won't swallow the Tylenol. He won't even drink water now. He's looking dehydrated. The nurse talked to the doctor. The nurse called back and said, the doctor wants him to go to the hospital. Now, mom lives in a rural area. She didn't want to drive 20 minutes to the hospital. She was a single mom with 3 kids. It was afternoon. She knew it was a long wait. So she called the family doctor and said, what are we going to do? They talked about it for a while. Family doctor said, try to give the Tylenol. Mom tried. Child didn't want anything to do with it. His throat was so sore. So then mom went ahead and asked, was there something else we can do? The doctor said, well, we could give some topical medicine and ordered a fentanyl patch. So mom goes and picks up fentanyl patch, puts on her son, and within hours, her son was eating, drinking, his throat soreness is gone. Mom's so happy, thinking, oh my gosh, my family doctor helped me. No charge, because doctors don't charge for telephone calls at that time. And she was so grateful, and she was so upset with the surgeon who didn't even bother to call her back, just had the nurse say, go to the hospital. She's so grateful for family doctor. Next morning, she calls her son down for breakfast. He doesn't come. She goes to the room. He's not breathing. They call 911 to the hospital. They do the whole code thing, but he died of respiratory arrest from too much opioids. I had to review the whole thing. I looked at the ENT note. Even though it wasn't very long, I kind of thought, well, go to the hospital. That sounds like always a good decision. And then the ER, what are they supposed to do? They did the best they could. Mom and children are crying. They tried to do the best they could. Nothing they could do. The child was already dead when he got there. What about family doctor? What did I say? I said to settle. And the reason is not that fentanyl wasn't approved for kids at the time, it wasn't, but also it's just, these drugs are just too potent. We can't allow someone with not enough immunity to these strong opioids to get them. We have to be extra cautious. You have to build tolerance to this. So fentanyl is really probably the most potent of all of them. This is just crazy. And that's why we're seeing this staggering jump in mortality, because people are lacing these with all kinds of other drugs that parents need to know about the dangers of fentanyl. So we see, I showed you this death rates that are fentanyl is a third wave. Parents should know about this. So 50, 100 times more potent than heroin or morphine is these things. Acti, Duragesics, sublimase is cheap to produce and is produced and present in illicit street drugs. And it's being pressed into pills that resemble Oxycontin, Xanax, hydrocodone. These are the sought after drugs, and they're being cut into heroin and other street drugs. And loved ones buying these illicit drugs may think they know what they're getting, but there's a real risk of it containing fentanyl, which can be deadly. So naloxone does work, and that's the law that we're going to talk about today about using naloxone. It can help, but anybody gets naloxone has to go to the hospital, because naloxone only lasts a short time, and the overdose can last a long time. So you have to go right to the hospital to get monitored and managed there. And harm reduction helps, and knowledge about this helps. But if you have a child that's addicted to any drugs, they need help. And parents especially need help, because even if you're addicted just to marijuana, this is a gateway drug, and other drugs lead to dangerous things like fentanyl. So we have to be extra careful, and there's resources to help. Now, do these drugs actually work? We know doctors prescribe these drugs for decades for patients, or years and stuff. And research has been done by the CDC, University of Washington, University of Health Sciences in Oregon, to look at all the publications to see, do they have any effect or benefit? And what we found is we have short benefit, but not long-lasting benefits. And we have all these side effects from them. Even more commonly have myocardial infarctions, fractures, abuse, overdose, etc. It's interesting. So people complained about this research and said, hey, that's not a randomized controlled trial. Just because they found those studies doesn't mean that these drugs don't work. Of course, we should keep prescribing to all our patients, blah, blah, blah. So the VA did a wonderful study called the SPACE trial. And they randomized patients to two possibilities. One, opioids for their arthritis and back pain, etc. And the other was Tylenol and Motrin, basically. And what they found is the kids, or the adults, it's not kids, adults in VA, adults who got the Tylenol actually did better on pain scores than the opioids. Crazy as it can be, there was no favorable difference and a lot less side effects on Tylenol, Motrin. Cancer patients. So we've been forever thinking that cancer patients, of course we should treat cancer patients with opioids. And what happens? Well, pain is common with cancer, no question. But what should we do about it? And here's a study done at University of Kansas. And they found that there was a 15-fold increase rate of substance abuse amongst cancer patients, women in this study, who had breast cancer, who were on opioids, than who were not on opioids. And in fact, if you look at all the risks, they were worse. Fractures, heart disease, serious infections, all-cause hospitalizations, everything that were worse in the patients on chronic opioids, which is probably not good for anybody. Do we have a problem with other drugs? Of course, I've talked about opioids, but we can't just stop at opioids. So stimulants. So stimulants are FDA approved for children and potentially for adults for ADHD and ADD, and they do work. But there's some downsides to all these stimulants. Adderall, Concerta, there's so many of these, Ritalin, etc. Are there important downsides? Clearly there are. Paranoia, psychosis, anxiety, depression. One of the things that's interesting is appetite suppression. So you get a kid on these stimulants, they don't want to eat as much. It's because I think they just block your appetite. So there's some serious side effects. Now, we have a lot of emergency room visits because of all this stimulant use. And in college, they sell this stuff. It's like widely available. If you have any college students, just ask them, can you get Adderall from somebody at college? And they'll bound to tell you, yes, you can. And you ask them, like, how many of your colleagues are using this? How many of your classmates are using this before their test? And they'll probably tell you some numbers north of 10%. So anyway, the world uses stimulants too, but we use a lot of stimulants. Up until 2010, we use almost as much as the rest of the world combined, and we're only 5% of the world's population. And these stimulants have serious side effects. In fact, we've now seen data from UCSF and other data studies that have shown increased mortality with stimulant abuse and stimulants combined with opioids and even regular old stimulant use. There's some risks. And this is a worldwide problem, not just US. Most countries are in the 1% to 2% of population kids getting stimulants. So this is a kids study. US, for some reason, we're in the 3, 4, 5, 6% range of stimulant use. Not sure exactly why we're so different from the rest of the world, but maybe it has something to do with marketing and selling and all of that stuff that happens with these drugs. I'm going to skip this slide. It's an interesting, weird slide. I think the bottom line is the reason doctors keep prescribing these is they think patients have better function when they're on these drugs. If you ask Heath Ledger, of course, he says no, it didn't help him before he died. He had to stop all these drugs when he was filming the Joker because it doesn't help you. In fact, it increases unemployment, it increases disability, it increases side effects, it increases non-compliance with other things. These are the downsides of these drugs. I'm going to skip this case because it's an adult case, but just talks about the ceiling. You know, the state of Washington did some studies on the ceiling, and they found that morphine, total morphine dose of 100 milligrams a day led to 2% overdose rates per year. That's a crazy number. But low dose had a demonstrated less effect. The VA found the same data that overdose death rates were 7-fold greater when you use the high dose versus the low dose. So the VA instituted protocols and they've reduced it, which is great because we don't want overdose prescribing of this. Now it's interesting when you look at who does it. It turns out it's family doctors who prescribe the most of this. Now, some of you may have heard some of these drugs before. Oxymorphone, it's gone. Opana, gone, because the government said, well, just too many people are dying. They were getting all these fax reports coming to their fax machine about deaths from patients on these drugs that they ran out of ink. And you know how much ink costs? If you're trying to buy ink, it's costing as much as your printer. So they had to like, oh, ink is too expensive. We're canceling this, and called Indo Pharmaceuticals and wanted to cancel. In 2001, they wanted to do the same thing with OxyContin, but the makers of OxyContin came back and said, oh, we can make it tamper-proof, and they got an extension, which is still today. As you see, fentanyl, oh my gosh, this drug, super dangerous. We talked about that 100. So if you've ever seen Into Thin Air, if you watch the movie, people who are climbing Everest, they don't stop at Camp 4. And they get up to Camp 4, they rest for a little bit. This is 26,000 feet. And they meet in the middle of the night, they hike to the top of Everest, and they, before 12 noon, they hike back down past Camp 4. If they stay at Camp 4, they just die. And 100, 200 milligrams of morphine, that's kind of that level. When you get these levels, and it just can kill you. And so if you look at fentanyl, especially with kids, you're crossing that level. So you have to be tolerant. Otherwise, you just may die from it. Even the lowest prescription dose you could die from. Now, the FDA has said, oh my gosh, this is a big problem. The statewide opioid safety works group also said this is a big problem, but they know stopping people right away can be dangerous too. So what about urine drug testing? Some of us parents, smart as we can be, buy this stuff. It's great. You can buy it online, $5, $10 a test, less even. If you get a bunch of tests, you buy it on Amazon, and you can do these tests in a medical office, but you can do them at home too. And it kind of gives you some idea of whether someone's taking them. The problem is these tests are, although cheap, they're limited by cross-reactivity. They can have false positives, and you miss your false negatives. So fentanyl won't show up on these cheap tests. So to get that, you have to do this expensive $300 test that takes a few days. And so, which is good, but so we have to be a little careful, just assuming that that test that we do at home is good enough. If it shows something positive, that's helpful. Go get that investigated. If it shows negative, it doesn't mean your child has not been using these drugs. Now, the CDC has been telling doctors how to do it. One of the ways is to talk about urine drug testing as like the airplane says. We just have a standardized protocol that includes this, so patients don't feel like they're being isolated. Now, how long do drugs stay in the system? It turns out that marijuana stays in for a long time, for like 30 days. Methamphetamines stay for a number of days as morphine, alcohol stays for a number of days. Cocaine, shorter, some other amphetamines can stay shorter. So this gives you an idea about the dates. So if we're going to do it, doctors trying to tell patients, this is kind of standard, review what we're going to do with the results. Of course, we have confusing situations doctors do about these results and how to figure out the results. And I'm not going to talk about that in too much detail for all of you guys. This slide I think is important. It turns out that when patients die, kids and adults, from overdose, most of the time it's not just one other drug. Only 1/3 of the time it's one drug. Most times it's drugs plus alcohol, drugs plus cocaine, drugs plus benzos, like opioids plus benzos, etc. And this combination of opioids and benzos is really important to talk about because a lot of people are dying from benzos. So if you look at this slide, you'll see that the death rates from benzos is very high and is going up. So this is the Xanax, Valiums of the world, Ativans, etc. And if you combine it with synthetic narcotics like fentanyl, super dangerous. If you combine it with any narcotics, dangerous, and that's going up. And so we have to be extra careful. So what does the FDA say about this? So this is Robert Califf, who's retired. Because of this crisis, he had to retire later. He was blamed partly for this crisis, but on August 31st, 2016, he sent a letter to all doctors and said, it's nothing short of a public health crisis when you see a substantial increase of avoidable overdose and death related to two widely used drug classes being taken together. We implore healthcare professionals to heed these new warnings and more carefully and thoroughly evaluate on a patient-to-patient basis whether benefits using opioids and benzos outweigh their serious risks. And then he put a black box warning for doctors on 400 drugs. Now, he hasn't done that for stimulants, but I think that's coming next. Okay, now, you probably don't know this, but I'm going to share with you another story of a young woman I met who was on one of these drugs that shouldn't be allowed to be prescribed by doctors, but still is. And the drug she was on is flunitrazepam, or she got this flunitrazepam. How did I meet her? Well, she was on the train, and I'm driving the train from Los Angeles to San Diego, this Surfliner, and she's sitting next to me. She's a USD law student, a young girl, and I noticed she has one leg only, and that other leg gone. And so I asked her, like, what happened? And she sighs for a little bit, then she tells me her story. She said she and her friends went clubbing together in LA, and they saw this weird guy next to her. And so they grabbed her and they took her in the car. They wanted to save her from this weird, creepy looking guy, and they put her in the car and they started driving home. And on Freeway 5 coming home, she stepped out of the car driving 70 miles an hour. While the car was driving, she opened the door and walked out. She had no idea where she was. And she survived 26 operations, lost her leg, etc. Now a student or finished her law school probably recently at USD. And what had happened is she was in this bar and some guy came up and drugged her with flunitrazepam, which was in her system. This drug should not be allowed. Doctors should not be allowed to prescribe it because Rohypnol, or roofies as known on the street, very dangerous. I think it's more diverted and abused than actually used in real medicine. So the companies have been told, stop making it. The company said, okay, we'll make it tamper resistant. So they make a blue dye. So you drop it in water, it turns it blue. But oh my gosh, a blue dye doesn't work in a dark club, or if your glass is opaque or you have an opaque drink. So that's not enough. I've been on the train like multiple times, Los Angeles, San Diego. I sat next to 5 women during this time. And I said, another woman who's a doctor, OB/GYN in Orange County, she's coming back. She told me while she was in Las Vegas, she put her drink underneath the table. The next thing she remembers, she's naked in a room that she has no idea where she is with her clothes on the side. So 5 women I sat next to, 2 of them got this. This drug is more commonly abused than we think, and we need to do everything we can to stop prescribing it and not let this out there in the community. We should remove it. Tramadol, not the most dangerous. I'll skip it, but there is some abuse risk for this. Let's talk about these sleep drugs. So doctors prescribe a lot of sleep drugs. And these sleep drugs vary from Ambien to temazepam, which is Restoril, to sedative antihistamines, etc. And they are dangerous. They increase mortality. Even if you're taking a few of them, mortality may go up 3-fold. If you're taking a lot of them, it may go up 5-fold. And it's crazy that this could be a problem. Here's a picture of Jamarcus Russell. Now, Jamarcus Russell was the first-round draft pick of the from LSU to the Oakland Raiders. In LSU, he threw nothing but touchdowns. In Oakland, he threw nothing but interceptions. Why does such a great talent, #1 draft pick, come to the NFL and just flop. Well, this is what happened to him. He showed up injured, and his manager said, you cannot tell the doctors about the injury because you're going to get graded down and you won't get picked as high in the draft. So he told his colleagues, other combined athletes at the combine, what to do, and they gave him this purple drink, which is codeine cough suppressant, which is useless anyway, and he became addicted and drank this before every game. Eventually, the Oakland Raiders released him. They literally know that he was addicted to this stuff, and he later was caught trafficking in Louisiana, selling this. The judge gave him probation, and he had to go educate kids about the dangers of this purple drink, which is like the hip hop word for the codeine cough suppressant that's being misused by young people. Again, kind of stupid, but it happens. Non-controlled drugs, we have to worry about them too. These muscle relaxants, oh my gosh, they're overprescribed, dangerous, have central acting, and kids can abuse this stuff too. So we should be extra cautious about this, and we should stop. The police and the attorney generals, they really worry about combinations. The combination they're most worried about is what they call the Holy Trinity. Holy Trinity is any combination of an opioid, a benzo, and soma, or opioid benzo stimulant. This combination of all these drugs together, super dangerous, and we have to be extra cautious. So I'm going to skip this on gabapentin. Gabapentin abuse happens, but it's not as big of a problem. It's now become controlled. So I'm going to talk about a few other things. And so here, let me see, can melatonin be addictive, dangerous? I don't think so. Melatonin, I don't think so. Not a problem. Okay, so NetDoctor employs US licensed physicians to review your medical history and prescribe over the internet. Do we think should this be allowed? These are non-controlled drugs, by the way, Cipro, Propecia, Viagra, etc. What do the feds think? Well, the feds say, here's a picture of the DEA website. Some of the internet sites facilitate illegal sale of prescription drugs that enable some consumers to illegally purchase controlled substances without realizing they're committing a crime. So that's one thing they say. Federal law says to get a prescription controlled drug, you have to have a legitimate medical purpose, and you have to get it from a doctor, health professional, like a nurse practitioner or a physician assistant. You have to have a complaint, which we could do on the internet. You do a history, which you could do on the internet, but you have to do a physical exam, which obviously we can't do on the internet. And some logical connection exists between all of these things. And one case in San Diego was a young man who comes home from drinking at PB. His girlfriend noticed how drunk he was and says, you can't come in, locks the door. He falls asleep on the PB lawn. She feels kind of sad for him, and it's cold, winterish. San Diego's not too cold. Brings him a blanket. Then in the morning she wakes up, she feels like embarrassed because the neighbors might see him. So she went to get him, to bring him in the house, and he's dead from overdose. They call the 911, the police come. Coroner says he died of alcohol and OxyContin. And what's interesting is his OxyContin prescription was given by some